So good afternoon or good morning, depending on where you're joining. And it's always easier in Swahili because it's one word, whether morning or afternoon. Habari. I'm Evelyn Gitau, as Lara has said. I'm the Chief Scientific Officer at the Science for Africa Foundation. And I'm really greatly honored to join with you today to celebrate what has been a week of celebrating Africa Day 2025, and to also reflect on the pivotal role of science and innovation in shaping our continent's future across economic integration, public health security, and sustainable development. So at the Science for Africa Foundation, or I will refer to it as SFA sometimes, we exist to strengthen and promote African-led science. We are a Pan-African nonprofit organization focused on enabling science to deliver tangible impact. Our mission is not just about knowledge production, it's about translating that knowledge into better lives and stronger systems. Africa's challenges are complex and interconnected, and we believe that the solutions must be African-led. This includes tackling fragmentation in our research and development ecosystems, adapting to funding volatility and the current geopolitical shifts that we've seen as a result of changes in funding from governments that normally support Africa, and importantly, pushing for deep structural transformation rooted in science and innovation. So as a foundation, we align ourselves with critical development agenda to ensure we are meeting what has been prioritized by our governments. The first one I will mention is the African Continental Free Trade Area, which is a visionary step towards integration across the continent. But for it to succeed, we must treat science as critical infrastructure, supporting harmonized regulations, biomanufacturing, and regional data systems that will underpin both trade and public health security. The second agenda of critical importance to us at the Foundation is Africa's Agenda 2063. Our work is fully aligned with Agenda 2063 by ensuring that our programs contribute directly to the aspirations of prosperity, people-driven development, and global influence. The third agenda I want to mention is the STISA agenda. Our flagship programs help deliver on the science, technology, and innovation strategy that was set for Africa. Initially, the STISA 2024, which has now transitioned to 2034, across its core pillars. We are working closely with AUDA NEPAD to ensure that our implementing partners help deliver on the STISA 2034 agenda by ensuring that their national programs are also trying to address and implement the STISA agenda. We guide our work at the Foundation using what we call our 5Ps lens: people, places, policies, products, and partnerships. In terms of people, we are working to generate a critical mass of scientists who can lead the transformation of Africa through science. In terms of places, we work to support the development of conducive environments with state-of-the-art infrastructure and equipment to produce quality research and development data for evidence and decision-making. In terms of products, we support innovation from early discovery to translational phases to the clinic, from the R&D for climate smart innovations to agriculture for food production, to commercialization of products for economic returns and public goods. We are very, very passionate to ensure that we support the ecosystem across the whole value chain. In terms of policies, we work by engaging delivery actors, including governments, private sector, and communities. And in terms of partnerships, we pursue equitable and strategic partnership across Africa and globally to ensure that research is not only co-created, but is equitably being addressed across the continent. I will now spend a few minutes giving you a glimpse into some of our strategic programs that we have been delivering since our inception slightly over 4 years ago. The first one I will talk about is Deltas Africa, which is a long-term Africa-led initiative which was originally launched in 2015 to strengthen scientific research capacity and leadership across the continent. We as the foundation manage it and are supported by Welcome and the UK Foreign Commonwealth and Development Office, FCDO. Deltas Africa represents a significant investment in the continent's research ecosystem. The strategic pillars of Deltas include scientific excellence, where we promote high quality, impactful research aligned with African priorities. We support the development of research leadership, where we are working to build the next generation of African scientific leaders through structured training, mentorship, and career progression pathways. The third pillar works to enable research environments by strengthening institutions through infrastructure, grants management, and research support systems. And the fourth pillar is around scientific citizenship, where we're working to ensure that the research that is developed under Deltas Africa contributes to policy, community needs, and broader development outcomes. Deltas has had many achievements in the last many years. In the initial stages, it supported 11 consortia across 8 African countries and 54 institutions. In that stage that ended in 2022, it trained over 2,000 master's, PhD, and postdoctoral researchers, and it strengthened institutional capacity and contributed to national and regional policy in health and development. The current phase, called Deltas 2, started running in 2023 and will run up until 2026. It has 14 consortia led from 9 African countries and involves over 75 institutions globally. The thematic areas in Deltas 2 include infectious and non-communicable diseases, mental health and neurosciences, planetary health and climate change, implementation science and public health, social sciences and humanities, and greatly emphasizes on locally contextualized research and intra-African collaboration. There are many programs. Of the 14, I would just like to mention a few in Kenya, which is the Consortia for Advanced Research Training in Africa, which is working with public universities across the continent. Work with Deltas 2, which is a Ghanaian-based consortia, which is using genomics to tackle infectious diseases and non-communicable diseases. We have SACAB in South Africa that's advancing biostatistics for population health, and Amari in Zimbabwe, which is addressing mental health treatment gaps through research and policy integration. Please feel free to go to our website to read all about the 14 consortia. The next program that I would like to highlight is the Grand Challenges Africa program. This is a catalytic funding mechanism that supports African-led innovations, targeting pressing challenges in health, development, and science. It uses the Grand Challenge model to identify bold ideas with potential for transformational impact. Key features include running thematic funding calls for innovators on priority issues such as maternal health, mental health, antimicrobial resistance, climate, and planetary health. Through this program, we provide seed grants, as well as technical mentorship and visibility for innovators at global innovation platforms. We try to support innovators from research to implementation and policy translation. And to do this, we have worked with several partners across the continent, including the Gates Foundation, Welcome, Foundation S, Grand Challenges Canada, amongst others. We have also now recently expanded our portfolio to include areas that have been totally neglected on the continent, including funding innovations in non-hormonal contraceptives, looking at funding innovations in digital diagnostics, and other context-specific health solutions as we continue to partner with national grand challenges at country level. We also host high-level convenings to showcase African innovation to funders and policy stakeholders. The next program that I would like to highlight very quickly is, I think I jumped one slide, is the Open Research Africa, which is a digital publishing platform dedicated to rapid, transparent, and accessible dissemination of African research outputs. We support the principles of open science and equity in knowledge sharing as a result of the fact that a lot of science that is done on the continent continues to be not have the type of visibility that we need for people to understand and know that the knowledge is being created on the continent. The core benefits of publishing in our open research platform is rapid publication with open peer review and data availability. It is at no cost to other authors, so we bear the cost of publishing, and addresses the barriers faced by early career researchers who may not have the money they need to publish their publications. We are inclusive of diverse fields, including health, agriculture, education, social sciences, and emerging technology. And we encourage the use of local languages, although the uptake for this has not been that high, community engagement, and co-authorship with non-academic actors. The main idea for open research, and we're broadening this up beyond the platform, is to promote African knowledge leadership, to ensure visibility and uptake of Africa-based research in global fora, and to foster transparency, reproducibility, and trust in scientific outputs that come from the continent. One other initiative that has me excited is really the idea that we can work with private sector across the continent to see how we can enhance development across the continent. So our Cross-Farmer Capacity Development Initiative, CPCDI, is a collaborative initiative that is led by the Science for Africa Foundation and supported by Johnson & Johnson to build sustainable capacity in clinical research and regulatory science across Africa. It connects African institutions with pharmaceutical companies and regulatory authorities. Its main objectives are to strengthen clinical trial readiness across institutions through workforce development, infrastructure enhancement, and good clinical practice training. We work to support policy and regulatory harmonization aligned with WHO maturity levels, and we work to facilitate mutual learning through communities of practice and technical exchanges. The important thing for us in this initiative is that it responds to Africa's need for sustainable clinical trial ecosystems. It encourages co-investment and aligned incentives between public and private actors, and it provides a foundation for phase 3 trials, which rarely happen on the continent, helps to enhance biomanufacturing partnerships, and health innovation scale-up. One other area of work that we have now been working on is artificial intelligence, because as a foundation, we recognize that AI and emerging technologies have transformative potential for health, science, and development across the continent. Our work in this area is designed to ensure African leadership in shaping and applying these technologies responsibly, equitably, and effectively. The key drivers for this work include rapid global advances in AI with limited African representation in development and governance, opportunity to leverage AI to solve context-specific challenges in health, agriculture, climate, and education, and the need to develop regional innovation capacity, data governance frameworks, and inclusive ecosystems. SFA's approach to AI and emerging technology spans several strategic domains. In AI for health, we are supporting AI tools, the development of AI tools for disease surveillance, clinical decision support, precision medicine, and diagnostics. In terms of data and infrastructure, we are strengthening data ecosystems and access while addressing gaps in African genomic, clinical, and social data. In terms of responsible AI, we are promoting ethical use of AI through engagement with policymakers, ethicists, and civil society. And we did recently announce and publish our AI governance policy briefs and reports. We also support capacity building, where we are trying to equip African scientists, innovators, and policymakers with the skills and infrastructure to lead AI development. Examples of SFA-led or supported initiatives include the inclusion of AI components in our Grand Challenges Africa calls, where we had calls that had AI solutions for digital health, climate smart agriculture, and AI for health specifically. We are also supporting AI in clinical research design through the Cross-Pharma Capacity Development Initiative. For this work, we are collaborating with international actors, for example, Wellcome, WHO, Africa CDC, on AI governance and equitable technology access. SFA plays an active role in shaping the global conversation on AI and equity and governance. We are participating in global dialogues, most recent, the recently finalized World Health Assembly, AI for Good Summit, and regional policy forums. We are advocating for Africa's inclusion in the development of global AI standards and frameworks, and we're supporting interdisciplinary research that integrates social sciences, ethics, and technology assessment. Personally, because I am a strong advocate for precision medicine, we are also expanding our work in AI-enabled precision medicine and health equity, open innovation platforms to accelerate Africa-led technology development, funding mechanisms to de-risk emerging technology innovations, and supporting the creation of frameworks for responsible innovation, data sovereignty, and accountability. We envision a future where African innovators shape global conversations and solutions on AI, not just as adopters, but as originators of technology that reflects the continent's values, challenges, and aspirations. Now, before I close, I cannot close without talking about our work where we are trying to develop policy and evidence uptake across the continent. SPEAR is a policy engagement program developed by SFA to increase the impact of research on policy making. It helps bridge the gap between research outputs and their application in real-world decision-making. In terms of how we deliver on this, we have developed a few programs that will allow us to do this. The first one I will mention is policy fellowships, where we are embedding researchers within policy bodies such as national public health institutes for co-creation and real-time translation. We are engaging in regional dialogues where we convene teams to align evidence with regional and continental priorities, such as the priorities set in the AU Agenda 2063. And this was done in a recent conference that we had, Evidence for Policy, in Nairobi. We are also working to develop policy labs where we will help co-design tools, briefs, and strategies to communicate research effectively to non-technical audiences. For us, we consider this as really integral in ensuring African-generated evidence informs national and continental priorities, that we strengthen relationships between scientists and decision makers, and recently I was reminded it should be science to policy to politics. So the decision-making really is to try and influence our politics on the continent and to build institutional capacity for evidence-informed policymaking. So as I close, I just would like to mention our impact in the last few years. In just 3 years, we've supported over 1,000 scientists across more than 40 countries on the continent, which is really, really exciting. We've helped pilot or scale dozens of innovations, from health tools to policy mechanisms, and we've contributed to stronger research systems and increased sovereignty over our own knowledge systems by supporting policies that will ensure we own our data, we govern our data, and we share our data in an equitable manner. Let's skip the slide. Yeah. In all this, equity is the core to our model. In all our programs, we try to ensure geographic representation. As I mentioned, we have worked and are implementing in over 40 countries. We do hope that eventually we'll be covering the whole continent. We try to ensure multilingual access as much as possible, and we are working very hard to see how we can use technology to really, really advance the use of local languages and African languages across the continent. And we ensure that there's gender equity in all our programs. And this has been one of the areas of success where we see almost 50-50 representation in most of our programs. We also champion the inclusion of social sciences, which has continued to be neglected when it comes to implementation. And we include lived experiences in research, helping to produce solutions that are both rigorous and relevant, and that include all vulnerable or commonly excluded populations on the continent. None of this work that we do could be possible without our partners. We've worked with numerous governments from Rwanda to Nigeria and many, many more who are part of program delivery. We've worked with regional bodies across the continent as listed there. Our primary partner, AUDA NEPAD, Africa CDC has been working with us, and institutions like AFIDEP continue to be partners in many of the things that we do. And not listed here, but is included, is many of the national science granting councils across the continent. We have global partners who continue to support our work. These are just a few, but we have worked with over 14 partners across the globe. We work with academic institutions across the continent to the tune of almost 86 institutions across the continent. And we also work with multilateral agencies, including UNEP, UNESCO, and the UN to deliver on some of our work. This is really work where we try to co-create science and innovation that meets Africa's needs and shapes its future. So as we move forward, there are many things that we want to think about as a foundation. We're looking forward to doubling on our strategic priorities by scaling genomics and biomanufacturing, advancing our agenda on data governance led by African institutions, which is really important right now as we shift in terms of funding and in terms of ownership. And we are working to build multi-sectoral innovation hubs. This is how we future-proof the continent, by investing in the systems of tomorrow today. So as I close, let me end with a call to action. Africa's future is science-driven. Let us invest boldly in African ideas, institutions, and talent. Let us commit to shared innovation, inclusion, and resilience. And together, if we do this, we can build the Africa we all want. Resilient, united, innovative, and most importantly, sovereign. Thank you, and over to you, Lara.